instead of Zoom. Do you know who that
Yeah.
person is? And I can send, and then we can send them the Zoom link.
Okay. They're in. So yeah, they probably had to toggle there. Thank you, Dr. Richards.
Oh, no problem. We literally talked about this for an hour to try to do a workaround. Microsoft Team does not play nicely with Zoom. They want you to use their own proprietary software. So
Exactly. Well, so again, the call for proposal is on our website, and then we can go ahead and transition on to the next area, which is the Inclusive Healthcare Task Force Subcommittee updates and reports.
thank you. So this next segment, we're going to have subcommittee report outs. And first up, we have Janine Hatcher from the Healthcare Subcommittee.
Good afternoon. I do not have any updates to share today. Is there anyone else on the team that may have updates? Thank you.
Hello, good afternoon, everyone. This is Ann Holmes Davis. Just wanted to note that the healthcare subcommittee has been meeting, and of course, the focus of the work of that committee is to embed the 4M or the 5M healthy communities philosophy into some training so that we can train community health workers.
Are they trying to block it? Oh, sorry.
So that we can embed that philosophy into training for community health workers, home health aides, as well as paid caregivers. So one of the things that we have decided to do is to sponsor a convening of these targeted groups so that we can get their input and shape the curriculum that's to be developed. And this particular curriculum will allow professionals who are working with older adults in their home to make sure that they are allowing the voice of older adults to be heard, that they're helping them with mobility issues, medication management, any kind of depression or dementia, so that they can age in place within their home and community. So that's the major work of the healthcare subcommittee. And so we're planning to have that convening soon so that we can make sure that as we shape that curriculum, that the individuals who will be impacted will have the training that they need to be more age friendly to our targeted population.
Thank you, Anne. And I've also pasted a link in the chat if you're looking to get additional information about the 5M framework. All right.
We're very pleased that we have individuals from universities and from the community-based setting to help shape this strategy.
Thank you, Anne. Let's see, anything else from the healthcare subcommittee that to bring up before we transition?
No, but this is Brenda. Is it possible from our last meeting that we had slides that had bullets with the topics for our committees? Is that available?
The committees are also on the website. I'm placing the website page and a link to the web page in the link. I'm sorry, the link into the chat. And it does give a breakdown of the committees on the website as well.
Okay, yeah, that wasn't exactly what I was looking for, but that's helpful. Thank you.
We will get you what you need.
Well,
Brenda, do you,
go ahead.
I was just gonna ask you to, I just want some clarification so that way we can get you what you need in terms of like what you're looking for.
Yes, at our last meeting, we actually had like a flow of what our committees were doing. And I was looking for that.
That is going to be shared later on our agenda.
Okay,
The tracker and the work plan.
yeah,
That we're,
that would help me deliver my report. That's why I was asking for it. Thank you.
well, just update
Yes.
the group and then I'll chime in.
Okay,
Brenda.
thank you. Thank you.
Thank you.
I'd just like to add that would be helpful going forward if we had just a couple of bullets to help the committee chairs to share their report.
Will do.
Mhm.
Thank you, everyone. Next up, we have Pat and Christy King from the Education Subcommittee.
Okay, good afternoon, everyone. Our committee had some robust discussions around publishing a directory of digital literacy classes and whether or not that was necessary or needed. And maybe a better plan would be to discuss the barriers for those people who are intimidated by digital literacy. And also, so that discussion had to do with addressing the barriers and providing additional support to those who have devices and making that available. So that's where we left off. And so further discussion is going to be needed before we can come to make some decision. That's pretty much it.
That one other issue that has emerged from the education subcommittee discussions is the fact that we need to determine the best type of technology to select for older adults, given the fact that some don't have Wi-Fi access. So we've had some discussion around would that be smartphones, or would that be some other type of device that we have not looked at previously. So that's some of the things that we'll be looking at. And I think the focus group discussion or presentation later will sort of lend some legs to that discussion.
Thanks, Ann.
Thank you. Anything else from the Education Subcommittee? All right, next up we have the Social and Community Context Subcommittee. Phyllis, welcome. I see Phyllis's otter, but
Oh, Phyllis left a message. She's in the doctor's office and her
Okay.
appointment has run over. Yeah.
okay. Okay, so we can.
Okay,
We'll
I'll
circle.
provide an update. The Social and Community Context Subcommittee has been looking at ways to prepare the community for using the mobile app that's to be developed. And so one of the things that they've been looking at is how can that mobile app be named and be promoted and used throughout the community. So one of the things that they talked about was particularly possibly having a contest to name a mobile app for older adults that will be designed to help older adults and caregivers navigate community resources. We also have had discussions around how to incorporate training that's to be developed through the pop-up technology facilities or venues that could help facilitate encouraging older adults to use mobile apps. So stay tuned. It's really felt that we need to engage older adults as that mobile app is developed, so that as they shape it, it's user-friendly, has large font, and it's easy to use, so that they'll use it whether or not they live in the community or outside, particularly if you have caregivers who need to navigate what's available to older adults.
Thank you, Anne. Next up, we have the Neighborhood and Built Environment by Brenda Price. I know that you mentioned having bullet points, but was there anything that you wanted to add?
Sure. I think one of the key things in our committee that we talked about were things that also overlap with other committees, particularly the lens around digital inclusion in our communities and for older adults, and leveraging our resources, not trying to recreate the wheel. And who else could we bring to this table? And it was suggested that we bring to the table the City of Detroit Digital Inclusion Department, and I think those connections have been made for them to be engaged here, because they have all of these hubs. And how do we leverage existing resources was something we kind of leaned into, so that what our work isn't producing more work. You know, how do we look at the public policy that is in existence that does not work around housing issues? One of our members of our team, she really leaned into that. I don't see that she's on the call, but we talked about what are those policies around eviction and taxes, et cetera, that should be better supportive of our community, or that the rules and the policies are there, but they're just not working around these issues of housing and transportation, et cetera. So those are some of the things that we looked at specifically. And I think we kind of all agreed that we need to lean into that a little bit more about existing policy issues around housing and housing development. And I'm sure you have some great things to add to this list.
Well, the Neighborhood Built Environment Subcommittee also discussed how could we engage some of the key policymakers in the discussion. So one thing that we talked about was having a convening similar to the recent regional transportation forum on DEI that took place in December around transportation. So we have had some initial discussions around engaging Wayne County, the City of Detroit, HUD, MISTA, around what kinds of policies need to change in order to address the issues that Brenda just noted. And also, how can we engage older adults and other stakeholders in that discussion? We also talked about having an age-friendly communities report card. And so in shaping that report card, we are looking at how we can convene the cities, the 9 cities within our community, to have a discussion around what an age-friendly community looks like. And then once we convene those older adults and other stakeholders, that will help us to utilize the age-friendly community report card to score how each community is doing as they implement their master plans within their city, making sure that housing, transportation, supportive services, and other things are in alignment with what older adults need.
Thank you, Anne.
Next up, we have the Economics and Retirement Subcommittee. Mary McDougall.
Hi, everybody. Well, we had a lot of discussion about the retirement needs of seniors, but recognizing that it really is an intergenerational problem, and that at all stages of work life, people need to be thinking about retirement, and that there's a lot of overlap. So in the toolkit, a lot of our focus is on the portion of the RFP that is about a toolkit on retirement tips and ways of planning for retirement that change from one type of age group to another. And although we're looking at principally looking at seniors, we know that the seniors retirement is going to depend a lot on what they did when they were younger, and that it impacts their children and it impacts their grandchildren. And so it really is very important that all those retirement pieces get considered and people begin thinking about them throughout the lifespan. And so it's a big challenge for whoever is going to put that toolkit together. We also wanted the toolkit to be a way to remind people of some of the documents that they need to have in place and have a place to put those, and along with having availability of information for family members. And so that's a big piece of what we're going to be expecting the vendor who does the retirement planning toolkit to put together. The other thing that we realized is that it's one thing to have the toolkit, but we also need to have presentations related to it. So there will be some presentations in the spring and into the fall related to retirement issues. And we think those are going to be really helpful. And of course, the task force, the focus groups that have been held, the information that they came up with is going to be useful too in the development of the toolkit. So anything else, Anne, that you want to add?
I think you covered it beautifully. Only thing I would note is that in that retirement planning toolkit, one thing that we talked about is making sure that there's a section that deals with young adults, middle-aged adults, pre-retirement adults, and then people who are retired. So we want there to be some tips and strategies that each of those 4 key groups can address as they hit those milestones in their lives. So we're trying to go upstream to make sure that young adults start planning for retirement earlier, so they're not in a crisis mode a few years out from retirement. Particularly with the prediction that Social Security may not even be around. So we want it to be something that's useful, and that will definitely include a section where people can put things that they ordinarily don't share, and or just at least have an index to where those things are if something happens. What are your passwords? Do you have a storage unit with off-site storage? Advanced directives, those kinds of things.
Thank you, Anne. Next slide. So next up, we have our Inclusive Healthcare Marketing Membership Drive. And Jeremy.
Good afternoon, everyone. How's everybody doing today? Can you hear
Jeremy,
me?
did you want to introduce yourself?
Oh, yes. I'm Jeremy. I'm from 98 Forward, and we are tasked with assisting the Inclusive Healthcare Task Force. So far, we have been working on identifying key community stakeholders for each committee, and of course, doing our relationship mapping and connections. Today, we assisted with booking Ms. Charlonda Bookman for this meeting, and our in-person event planning for the culminating event in May is going to start next month. And that's all for me for now.
If any of you have partners, stakeholders that you think need to be engaged for your particular subcommittee, please share that with us and we can make sure that information gets to Jeremy. For example, we're talking about the digital divide department, Connect 313. But if there are some specific groups that we need to engage, as well as consumers, share that information and we'll make sure that they're approached.
And it's Florence. May I add something at this moment?
Sure.
I was supposed to, I had recommended connecting with the union, the 1199. I don't know what they're called here, but I reached out to my contact in Connecticut. She gave me someone's name here. She and I have gone back once or twice. I sent her information about the 4M and what we were proposing to do with this. So I'm waiting for contact back from her, but I can definitely give the information to someone else if they want to carry the baton.
Sure, that'll be great.
Okay.
Yeah.
Just email me and we'll get it going.
All right.
Yes.
Because
Thank you.
as we look at some of those organizations that provide training, we really need to make sure that as that curriculum 4M, 5M training is developed, that we are making sure that everyone benefits.
Okay, and Dan, I'll make sure that you're CC'd on the email.
Sure, sure. Again, our email database is pretty robust here. We do include labor and unions in our outreach, and labor's local 1191. I think it's Miss Attorney Mikkel. Aaron is our contact, along with her dad, who's the business manager, Mike Aaron. So I know that they get the emails. I know they're interested. And they have a
Okay.
large retiree group. So yeah, love to see it. Thank you.
Any additional questions regarding the membership drive? Feel free to put any suggestions or recommendations in the chat. We do try and capture any feedback from that channel as well. Next up, we're going to have a presentation from Dr. Faith Hopp.
Thank you, Fayana, and so glad to be with all of you. I'm going to just take a moment here to pull up my screen and pull up my file. Okay, just a second. This is... Can people tell me if you see the first slide of my presentation?
Not yet.
Okay, I will.
Just see the screen.
Okay, so let me try that again. All right. And let's see. I'm just having some issues here, making sure my screen becomes available. So okay. There.
I did share the slide deck with Jocelyn. So if you need someone else to share it, we can do that.
Okay, can you see it now? You see it now. Okay, great. I really appreciate the chance to present to all of you, and it's great that I had a chance to hear your feedback from your groups and what's going on. I think you're going to find a lot of synergy between what you've been discussing in your groups and what our focus groups have been discussing. It's now 2:31, and I said that I would take 15 minutes for my presentation and allow 5 minutes for questions. So if someone could please pipe in when I have about 5 minutes left, just to remind me. I want to make sure that I get to the recommendations before they end. And I am part of a group that's part of the Wayne State University Center for Social Work Research, or CSWR, and I am the lead investigator for this particular project, the Inclusive Healthcare Focus Group Series. And I want to express my deep appreciation for the Detroit Area Agency on Aging. I especially, Mr. Taylor, of course, for funding this project, and Ann Holmes Davis worked so tirelessly with us to make sure and do the very best to make sure that we addressed the information needs of the task forces. And even yesterday, Ann was so helpful in making sure that this presentation would convey the information that's needed. So thank you, Ann. I'd like to just point out, you're going to see some, as we move forward, you're going to see some pictures that may be familiar to you of some of our focus group members. And I'm not going to give names, but I can say this, that every single person whose picture you see has provided written confirmation and agreement to have their picture included. And we appreciate their participation in this way. As you all know, the goal of the Inclusive Healthcare Task Force is to integrate social and environmental determinants of health with the goals of reducing health disparities and closing the gap on the technology digital divide. As you also know, we have 5 subcommittees representing each of the social determinants of health. I want to emphasize, because this was part, I recently reviewed the video of the opener to the Inclusive Healthcare Task Force that was about a year ago. And the goal is to be inclusive. So really focusing on that word inclusive, with no one left behind, regardless of where they live, socioeconomic status, race, and ability, disability, etc. So that's a really, really important goal, and that we strive to do in our focus groups. So the goal of our focus groups was to provide community input, meaningful community input, to inform the project implementation phase. And so we wanted to find out views for each of the 5 focus groups. For the health focus group, our focus is on how older adult services relate to healthcare issues. For education, we're interested in learning more about how older adults access services, as well as strategies to educate people about these services. The focus of the economics and retirement focus group was how the task force can best promote and provide information on retirement planning, particularly with the retirement planning toolkit, as we previously discussed. The social and community context focus group was really zeroed in on the development of a mobile app that can connect older people, those with disabilities, as well as family caregivers, to community resources. And then the neighborhood and built environment was focused on how the needs of older adults can be associated with age-friendly communities, and how to implement strategies to improve the age-friendliness of our communities. This is a project overview, mentioning that we have the Wayne State University School of Social Work and the Center for Social Work Research. All of the participants were reminded of what we mean by community, basically including all of the communities that comprise the DAAA service area. We had a total of 57 participants across the 5 focus groups and 57 completed surveys. This is just a breakdown of each entity. So DAAA provided funding, identified the focus group participants, decided on where these focus groups would be held, and then worked collaboratively with us on the focus group question development. Our Center for Social Work Research developed the focus group guides, which are basically the guidance on how the focus groups will be held. And we moderated, recorded, and took notes on each focus group with help from our students in our center. We distributed gift cards as a thank you to everyone for participating. We transcribed, analyzed the demographic data, and identified the major themes from the focus group. We had a pretty tight timeline for completing the focus groups. They were conducted between the end of November and mid-December. Fortunately, we didn't have a lot of snow during that time, so we didn't have as many issues with people getting there. We had a high level of participation, and the transcription and analysis was really going on right up through the end of last week, with a lot of help from our Center for Social Work Research. In terms of demographics, the age range was from 26 to 98 years of age. And the 26 and the 27-year-olds, that's because we had 2 students participating in our retirement and economics focus group. So that's why you see that lower age range. The median takes into account that skewed distribution. So it basically tells us that half are above and half are below this age. So the median age is 62 years, predominantly female, predominantly straight, heterosexual. What's shown here in the bolding is the most common category. So for marital status, the most common category was widowed, representing approximately 1/3 of the participants. The majority of participants were African American, and we also specifically included and recruited people who were Hispanic and Latino through involving the LaSed Community Center, Senior Center, and that's about a little less than 20% Hispanic or Latino. We strove to have inclusivity in the focus groups, and I think we succeeded to a large extent. I looked at the census data from 2018 to 22, and approximately 82.8% of people in Detroit of all ages are a high school graduate or higher. We were primarily, again, looking at older adults, and we had, our sample had about 80% who were high school educated or above. We had a greater proportion in our focus groups who had a graduate degree or higher. So that just means we did have a slightly higher education level in our focus groups compared with the city of Detroit as a whole. The predominant employment status was retired, and looking at monthly household income, I think this is really important to consider. Looking at the poverty level in the city of Detroit for 2023, it was $1,132 per household. So, and that's a very low level of income. We don't know exactly the poverty level because we have people with different household sizes, but you can see that about close to 40% of the people were making close to poverty level at around $1,200 per month, and with another 40% making between $2,000 to $5,000, and then about 1 out of 5 making $5,000 or over. So really need to focus, I think, on the proportion of people who are living close to having a monthly income that are close to poverty level in terms of their needs. I think this is really important, and I hope this is helpful for your purposes and your task force. Among our focus group participants, about 80% had used a computer in the last year. About 80% had internet service where they lived. And in terms of telemedicine, which we defined for them in terms of being an internet video healthcare visit, slightly less than 1/3 had participated in such a visit in the last year. Most of them of those who had a visit had 1 to 2 telemedicine visits, and the majority were somewhat or very satisfied with their telemedicine visits. The vast majority, about 91%, had cell phones, and of those who had cell phones, about roughly 76% had smartphones. Doesn't mean that they were using the smartphones to their full capabilities, but they at least had them, which is important. I'm going to go through the main questions and the themes for our focus groups. We focused on the 4 M's for the healthcare focus group. A lot of discussion here on prevention of disease, respecting autonomy in healthcare, especially at the end of life, and advanced care planning, which means designating someone to help make decisions for you when you can't make them for yourself. There was concern about dependency on electronic devices as well as over medication of seniors, and a focus on the need to monitor side effects and reevaluate the use of medications. In terms of mentation, there was a focus on recognizing signs and symptoms of dementia and anemia, the importance of seeking help and promptly addressing behavior changes, and using self-care to address mental health issues. In terms of mobility, there was a focus on the mental stress from pain and slow healing, impact of COVID-19, concern about opiates for pain, and also the importance of using both formal and informal support for mobility issues. The education group focused on the use of networking to access resources, the critical importance of respecting learning styles, concern with scam calls, some discomfort with technology, the importance of teaching navigation skills, providing support at community centers such as senior centers, and talking about senior hubs and community centers. So places where people can learn about computers, which I think was discussed in earlier when we talked about the education focus group. And then the importance of partnering with community organizations. The education group also focused on funding through the Michigan Lottery and perhaps a senior millage. They talked a lot about caregiving and considering the negative mindsets and changing the negative mindset about caregiving, open discussions about Alzheimer's and other dementias, and making the healthcare systems accountable for access. The economics and retirement focus group, a lot of people were talking about the bankruptcy of Detroit and the impact on, especially on city retirees, City of Detroit retirees, a lot of discussions about financial literacy, racial bias, the need for cultural sensitivity, again, the focus on scams and concerns about scams and predatory behavior of insurance providers, and really a huge focus on passing on the financial knowledge to younger generations. There was also a focus on using the toolkit to address transportation issues. Again, there was this major focus on addressing different learning needs of young versus older people, and the importance of making the training, if we do training in the schools, the public schools, that the training be inclusive and not limited to specific schools. Recognize people with certificates of accomplishment and have engaging content. Social and community context group focused on the importance of easy navigation, simplicity, clarity, and ensuring security of the app and search abilities. Patience is needed. There's need to recognize individual needs and learning styles and simplify technology. There, in the social and community context focus group, there was also a focus on teaching people how to use the smartphones that they had. They talked about targeting homebound individuals, which I think has not probably been discussed sufficiently in most of the focus groups because they were not homebound, they were attending focus groups. So there was an emphasis on targeting people who are homebound, and then really creating connections between tech savvy teens and older adults, senior citizens, and absolutely making sure that the app is organized, screened, and safe. The neighborhood and built environment, this was a bilingual focus group held at LaSed. And so it was very important, I think, that we did this focus group, and they were terrific in providing us information. They talked about creating welcoming and inviting environments, addressing issues around their housing, including senior housing, as well as neighborhood issues. The need to get to the doctor's appointment as a key transportation issues, addressing the financial burdens associated with transportation, and then greater coordination and reliability and eligibility for transportation services. Key issues related to neighborhood and built environment in terms of connectivity to the internet was helping people to use the technology that they may have been provided, especially Chromebooks, addressing specific financial needs, and helping people to advocate for their own help and ask necessary information. There is a huge emphasis here on providing bilingual caregiver support. And by the end of the focus group, there was a very big interest in advocating with local community leaders to raise awareness about caregiving issues and other neighborhood related issues. There was also a focus on home repairs and maintenance to help people age in place, addressing gentrification, and urging city officials to be more positive. So now I'm moving to recommendations. And what I've done here is we have, and our students helped to play a key role in summarizing the close to 9 hours worth total of focus group transcripts and discussions. So what I've shown here in italics and large font are really the key issues. So in terms of the recommendations that we're garnering from the healthcare group, it's very important to promote autonomy and self-determination, especially for people who are facing the end of life. Very important to help people to learn how to recognize health signs and symptoms, address issues around depression, dementia, and pain, and continue to promote active adults in local communities. There's an importance of supporting diverse learning styles. Really, really key also is that we can't just have apps, we need to have people behind the apps. We can't just have social media website, but there needs to be an actual person that they can call for information, not just the technology, not just the computers. It's important to think about the platforms. People have access to different platforms, smartphones, tablets, computers, as well as thinking about what types of technology. I'll put in a little, my own opinion, and this came out of the discussions, is that we can't ignore the fact that many people prefer to use telephones as well as video and camera monitors. So we need to think about the needs of older adults and what they're using. Not everyone is going to be interested in using an app, and the telephone continues to be an important way of providing healthcare information and interfacing with older adults. In terms of economics and retirement, it's very important that these initiatives address racial disparities, promote cultural sensitivity, and are part and parcel with transmitting knowledge from older to younger generations. The economics and retirement members want to be generative. They want to pass along the information that they've learned, the things they've done well, the things that have been a struggle for them, to help other members of the community be more successful, including younger people. This is a picture of the LaSed group, and again, they were very enthusiastic. Lupe, who you see on the right, Guadalupe Lara, she was key in helping us to do a truly integrative bilingual focus group. And this group really focused in on the importance of intergenerational learning, simplicity in technology, having patience with teaching. And again, this issue of preventing scams for older adult came up. They really appreciate having LaSed as a very welcoming environment, and they think that having welcoming environments for the teaching of technology is very important. And what was really highlighted in this group was the importance of having linguistically and culturally understandable materials and support. Just to give one example, we had in the English version of the focus group, we used the word aging in place. And what Lupe pointed out is that even if you translate a term like that into Spanish, that doesn't mean that people understand what that means in aging in place in terms of English or Spanish. So we really need to think about the language that we use and how to make the language accessible to older adults and help make people understand the gerontology, older adult type language that we're using. I didn't hear anyone say we were at our limit, but I've gotten to the end of my presentation. And again, this was a very meaningful project for us. It really gave me a lot of insight that I have not had before. And our students had a wonderful opportunity to participate as well. So thank you for this great opportunity. I hope it's helpful, and I welcome your questions.
Thank you, Dr. Hop. Let's see. Dr. Mendez.
Thank you. Great. That was a terrific presentation. Thank you so much. I have a question regarding the two students that were included. If they were removed from the population that you studied, what difference would it make in terms of income, education levels, as well as some of the responses to the questions, specifically the questions related to technology?
Okay, thank you, Dr. Mendez. I want to make sure I understand. Are you suggesting that there were probably some demographic differences between the students and the older adults?
Yes, given the age 25, and then you look at your higher level, I know you got down to 62, but if you remove those couple students, would it make a difference in, like, maybe the average would be 70 versus 62?
Yeah. Well, not to get deeply into statistics, but I deliberately use the median because yes, if we were to get an average, it would lower it very, very low. But I'll just tell you that the two students were law students, not from Wayne State, from a different university. And so, yeah, they did have, they did not necessarily have a lot of income. And in fact, they talked about the difficulties of getting health insurance as a student, but they certainly had, were poised to have a higher level of socioeconomic status. And so, yeah, they were different in that sense. But I think what was really great about that focus group is there was a lot of interchange and discussion about what are the issues, like, for example, that people, once you turn age 26, they have issues with health insurance. And so there was a lot of, even though you could say there was some differences, I believe both students were Caucasian and the majority of the people in the focus group were African-American, but I think there was a lot of interchange back and forth in terms of some of the pertinent issues.
So along those same, I'm not disagreeing with you there. I think, yeah, they did contribute toward the income level. I was wondering if the report can be segregated or split up between the age groups of over 55 or 50, whatever the Social Security age group is, onwards, and those below social. Because if you look at the retirement responses you got and the kind of training needed, maybe we should be looking at those that are currently in the Social Security bracket versus those outside of that bracket.
Yeah, that's a great point. The only thing I'll say is the limitation there is once we have their demographic characteristics, but once they were in their focus group, we didn't link their demographic characteristics to their comments, because that would have been violated their confidentiality in some cases. And just so anyway, but I think it's important to consider that we did have diversity in terms of age in our groups.
Yeah, thank you.
Thank you.
I think one thing that we were trying to do in the economics and retirement focus group was to make sure that we're hearing the voices of people who are younger, middle age, and retirement age, so that when that toolkit is developed, we'll be able to sort of speak to where people are during various phases of their life.
And the only reason I asked that is because if the toolkit comes back and says, we're planning ahead versus those who are already past the planning age, how do you include, it'll take more time than to segregate those. So looking ahead, maybe that's something to still consider when the toolkit is being developed.
Yeah, one thing I heard consistently in that focus group in the economics and retirement is they actually said it's sort of, we've got our situation in place. It may not be perfect, but we've kind of found a way through to our retirement. And they said, so in a sense, they didn't necessarily see the toolkit as most helpful to them. They really wanted to be using it seemed like a lot of the focus was, let's make sure the younger generations have the information they need to plan for their own retirement.
You hit the nail right on its head. That was what I was trying to get at, that it may not, as Mary pointed out, Ms. McDougall pointed out, that, when the persons are creating that toolkit, they will need more directions and help. So what you're presenting is useful, but I think maybe doing it by age segregation, grouping might help a little bit for whoever's doing the programming. And I think the same thing will come back, Pat, for our education group. It'll be similar to that. I can't see people on the screen because of the PowerPoint still being there. So I'm not sure if Pat is still on here, just talking to her.
I'll take it off. Okay. Yeah.
Pat, do you agree for the education group, we would have a similar situation?
Yeah, one thing I just want to notice that as Detroit Area Agency on Aging published the Diamond for Their Time report, which sort of catapulted us into establishing this inclusive healthcare task force. One of the things that we wanted to do is to figure out how can we go upstream and get to people sooner before their retirement so that we could provide education, supports, planning, so that the next generations won't hopefully experience some of the things that retirees or pre-retirement folks are experiencing. So that's one of the things we definitely want to do is how can we do some preventative care, upstream, get people thinking about it. Now, when you retire, there are tools that you still need to use. We have been doing Senior Money Smart Expos for last 15 years. And one of the things that we have been doing is looking at financial coaching and making sure that individuals every year will do a sort of a review of their investments, their life insurance, their benefits, and things like that, advanced directives, so that they keep that information up to date. So I think as we look at young adulthood, middle-aged folks, pre-retirement individuals, and then those who retire, we have to look at what are those tips and tools that can be built into the toolkit that can help those targeted groups plan and review, critical things that they need to be looking at.
Yeah, and like I say, again, the Retirements and Economics Focus Group was very much on board with the idea of passing down the information and this idea of prevention. They had a lot to say about what has happened, especially with the bankruptcy, but they knew that was a big part of a lot of discussions around how to even teach preschoolers more about money.
Dr. Hop, thank you for that lovely presentation. It's really interesting. Can you speak to your comment on the preference for telephone use and sort of like what are sort of like the implications for this project in terms of the feedback you got around telephone usage as a preferred method of communication?
Well, I should say I definitely heard this in our education focus group, but some of what I'm going to say about this I've garnered from other experiences. I spent 10 years at the VA working in the field of telemedicine, and I was principal investigator on a lot of projects. So I'm very familiar with the capabilities of telemedicine. However, one thing I noticed during the pandemic was the AARP had a really good series of discussions about COVID. And they did not have it on video. And they had things like they would have Fauci and Dr. Francis Collins on there talking about COVID, but people could dial in. There was just a very simple 800 number. And my guess, I didn't talk to anyone from AARP, but they did that because that was a way of getting the widest reach. So I was really struck by that because it was no matter what kind of phone you had, you could access that really critical information. And I also think about the needs assessment we did in 2019, where people talked a lot about the idea that they wanted to make sure that DAAA and other area agency on aging were the one-stop shop. They could call DAAA, the information and assistance line, and that they could get the information they needed in a timely manner, which just kind of makes me think is the idea is that, yes, we want to have apps, we want to have toolkits, but that somehow that also needs to be integrated into regular DAAA operations so that the people who are answering the phones on behalf of DAAA in the Information and Assistance Department also know about these issues. So that's partly my opinion and partly just a variety of discussions that I've had.
I think
Thank
one
you.
of the other things, Dr. Richards, is also the ability to have language translation happening while you're on the phone listening to these sessions. So maybe the Spanish, it was easier at that time to have it on phone. I don't know, Dr. Hop, if you had any discussions with Access, the Arab American group, to determine if they I'm assuming there wasn't a special focus group with them.
Yeah, we had we had discussed, I have discussed this with Omni in terms of the category. We had discussed at one point maybe doing that, but the since Access is also part of the Senior Alliance, they did focus groups there, but not this particular initiative has not gone there. So that's another area we might consider outreach to.
Yeah, as we plan our listening sessions in the next few months or year, that's one of the things we plan to do is to make sure we're DEI focused. So we definitely will be looking at the Arab American community, Hispanic community, Native American, Asian American communities to make sure that we get input from those groups. I think we probably need to move on to the next presentation.
Next up, we have Dr. Charlonda Buckner, who is the Assistant Superintendent of the DPS, who will be presenting on Parent Academy, a best practice model.
Dr. Richards, can I hear her presentation?
Yes.
Hi, good afternoon, everyone. First and foremost, I want to thank you all for having me this afternoon. I work for Detroit Public Schools Community District, as was just mentioned, and so there is never a dull moment. I tell people we have 110 buildings and roughly 50,000 students, and so it is a privilege to serve in this space. So I think for me, I'm going to spend just a few minutes telling you a little bit about who I am, because I do believe who you are and how it matters in terms of how you show up in this work. And so everything I've done, I believe is aligned to just my life experiences and why I've been able to move things and just always find a way to say yes. And so, so for me, I serve as assistant superintendent today, but that was just not the case a very long time ago. And so before I jump into this, Jeremy, I'll just share this. So just about 14 years, almost 14 years, I led Detroit's Parent Network, a not-for-profit organization that is still existing today. I think they focus more on early education. The last 8 years, I've been here at Detroit Public Schools Community District. But when I was a teenager, not so long ago, maybe 30-something years ago, I was put out of all Detroit Public Schools. I was not the kid that anybody would have bet on. I went through what was politically expedient for the community to really expel children from school, which resulted in thousands of children who experienced the same kinds of things that I did, but many of them did not get the opportunities that I was afforded that put me in the position that I am in today. And so I always operate every day with the idea that, you know, I have to pay it forward and I owe it. And I try to work in that direction every day. I think one of the most permanent memories from my own experience was being put out of school and having a parent who did not have a high level education, did not know all the educational jargon, was not politically savvy or any of those things, but what she did do was love her daughter. And my dad was active. They loved their child, even though they did not know how to navigate systems and speak the language that might have resulted in something different. And so that love was everything. And so for me, it was the community that came together that made sure I got my education, that ultimately I received my master's degree. And I could not wait to go back to the high school. Who decided I wasn't worth it, because we don't get to decide who children are called to be. And so I try to move that narrative every single day, especially working with our young people here in the district and really making sure that there's every opportunity for them to reach their full potential. At Detroit Parent Network, we did numerous things. But everything I did, I always thought about that moment when my mother was sitting there in a meeting being judged by folks, and her hand was shaking and she was very uncomfortable, and I could feel it even still today. And so as I serve people, I always think about what would have happened if my mom had had an advocate, a Detroit Parent Network, or a public school system that had somebody that would show up when things just went wrong. So I think, you know, over time, one of the things that we accomplished at Detroit Parent Network was actually growing it from just a couple hundred folks who were involved when I initially got there to having 5,000 members who actually paid for their membership in serving over 20,000 parents per year. There were some very specific strategies that I employed in that process, which included serving people where they are. We started an outreach campaign. I remember early on in my tenure there, people saying, well, we're going to go door to door. I'm like, absolutely, because people are unapologetic about what they share with you at the door. You know, our people are very chatty. And so I embrace that because I'm chatty too. And so it began, you know, once a year, a couple thousand doors to, you know, I think our biggest campaign was roughly 30,000 doors that we knocked on. And it was all about pulling parents out of isolation into the conversation. It was about building all types of bridges and on-ramps to create ways for people to get involved. And so we had all kinds of trinkets, like, okay, if you come to a workshop, you get free school supplies for the school year. And so there was all kinds of creativity and energy that went into valuing those that we aim to serve. I think another core piece of the way that I thought about the work and that I still hold on to today is just no judging. That people know when they are being judged or studied and all those other kinds of things, and really leading from a place that, you know, everybody has value. And so that with support, parents can solve their own problems, and that we're smarter together. And so I think when you lead with those things in mind, it makes a difference. And so in all of this work, it's about, you know, leadership and how you show up in those spaces and how you're valuing those people that you aim to serve. And so one of the biggest platforms that we created at Detroit Parent Network was our parent leadership training and curriculum. We had parent support groups all over the city. We ultimately served the district. Before I was here, we opened 8 parent resource centers across Detroit. That's how we were able to evolve to serving 20,000 parents. We were very strategically partnering with folks who had like values and where parents naturally gathered. So, so just a little bit of context around that particular piece. One of the significant things that happened is that I was able to travel the country, not alone, but with my parents. And I had a different set of parents almost every single time. Because every time people wanted to invest in me, I said, that's fine. If they wanted to invest in the work, that's fine. They wanted me to come to a meeting or be at a table, that's fine. But I got to bring my parents with me. And so I was always intentional on doing that. I didn't build a budget unless there was stipend dollars in there to recognize parents who would step up and take a leadership role and who could naturally, they were connectors and who could bring other people along. And so, you know, so for me, I intentionally led that way, and I still do today. When we traveled across the country, we were able to look at 10 different cities and some of the best practices in the field of family and community engagement and parent engagement. And so I was able to bring those practices back to Detroit Parent Network. One of those was what we call Parent Academy, parent leadership. In the district, we call it Parent Academy. And so we'll talk a little bit about that. Another was one of the things that I rest my name on. My favorite initiative was Parent Teacher Home Visit. And we piloted some things before we got there. Before I came to the district, I didn't know I was coming. Just a handful of schools. When I got here, my first year, we moved that program to 20 schools. And now just about every school in the district implements Parent Teacher Home Visit, a program practice that we got out of Sacramento, California. We built parent leadership training before we went on the road, but we also looked at what was happening in Connecticut and how they engaged legislators and others who were in position but could connect to and help our parents understand how to navigate systems. And so then we grew it to a huge collaborative effort. But I wanted to just pay tribute to the organization itself, which I think it's more about its members and the work that we actually did together. And then I think when the administration changed almost 8 years ago, I was doing my regular roundabout meetings with the superintendent, who asked me a final question, and that was to join his team. And I hadn't expected that, but what I saw was an opportunity to not necessarily join a team, but to scale the work that we had been doing in a different kind of way, that we had been working outside to infiltrate a system in a way that would better serve families across the city. And so for me, I saw it as a greater opportunity to serve and to scale the work from the inside out. So now we would go from working outside the system to working inside a system to move an agenda that meant putting children first, right? And I think we've done a lot of great work over the years. So I'm going to hone in now on this particular piece. And then I try to couch this presentation embedded in the questions that were posed by Jeremy. So this right here is just a visual of our catalog. We produce a catalog 3 times a year. There are 3 pillars in the catalog, which focuses on student achievement. In that particular area, it helps parents understand what their children should be learning by grade level. It helps parents understand how to navigate Power School. You can go back one, Jeremy. It helps parents with the tools that they need to support their children to be successful. There's a homework hotline. There's all kinds of things like that. This catalog is probably 50, 60 pages or so, but it's full of pictures of our children in action with their parents. This particular workshop here was a literacy workshop. What we found is that parents love to do things with their children. Obviously, they love to come see them perform. And we try to intentionally marry the fun things with the important, essential things. And one example, and then we'll move on, is we found that painting with a twist is a great platform that parents always gravitate to. And so, but we also need parents to understand that report card marking is coming, or testing is coming up, or this is our new policy on bullying and things like that. And so what I've been very intentional in doing is making sure we offer what we know is very attractive to our families, and at the same time, intentionally putting in front of them the other essential things that we need. Because, you know, people may not come to a workshop that's just on discipline, but they will come to something that makes them feel good. And people don't need one other thing to make them feel bad. And so hopefully you caught it. It is really about giving people what they want. Just think about parenting. You know, I'm going to give you the essentials that you want, but I'm going to sneak in the vegetables, all those different food groups that are critical for you to grow up healthy and strong. And so, so our catalog is built on those 3 pillars: the student achievement. There's a section just on parenting. You hear it all the time. Children you aren't given an instruction manual, I think is how it goes. I'm still looking for one. My son is 22 and my daughter's 14. I'm still trying to decide if I want to be a parent. It's a full-time job, but my kids are great. We've had challenges, but what I'm blessed to have been part of is just a network of people who share, you know, just ways to parent your children. And so they used to do parenting classes like at the hospitals and things like that. There's not a lot of that anymore. And so in parenting, it's dealing with some of the heavy issues that we see happening now with our children. You know, the substance abuse. You know, we have a large number of our students at all levels and in the elementary space who are vaping. Who are getting access to, you know, edibles and all kinds of other things that are impediments to their education, as you can imagine, and their health. And so in parenting, it's also about learning how to set boundaries, set expectations, high expectations. It is how to have tough conversations around, you know, human sexuality and things like that help them grow up, you know, conversations around sex and drugs and all the tough stuff. But it is also a way for you to connect with other parents around, you know, making quick meals when you work in your parenting, et cetera, et cetera. And then the third pillar is all about you. It's about personal and professional development. We've partnered with different groups. We had a number of parents go through our phlebotomy training, where they were actually able to get certified for free for a period of time, that I was covering those fees, because what we understand is that if parents are doing better, their children are going to do better. If they have better economic opportunities because they've gained an additional skill, their households are going to be better and better sustained, which for us tracks back to attendance and children who are at school focused and ready to learn. So I'm going to get into the questions, and then I will pause and just make myself available for questions. So let's go to the next slide, please, Jeremy. All kinds of challenges today. My computer crashed, and it's been a whole day. So, you know, steps to outreach, I think, was one of the questions that, you know, folks asked. And, you know, one of the things that I always say is, you know, we want to look at data. certainly in developing the Parent Academy, it really was about looking at not just collecting additional data. You know, it's a pet peeve of mine. People are tired of being studied. But it also is looking at what is the data that's actually there. You know, what is happening in community. Before we develop each of these catalogs, I always have a conversation with my staff and I say, put everything down. Like, what's happening? What are parents looking forward to? You know, what are the issues on the table right now, so that we're not so focused on the data that we miss some of the human elements, right? And so, you know, obviously for the fall catalog, it was about the fact that, you know, parents are getting ready for the holidays. We know people get stressed out. We know that this represents a season of loss where people have lost families, especially with the pandemic, which exacerbated things. We know that there's a high suicide rate around that time. And so understanding what's happening in the community during that particular time then leads to, and how do we support them through Parent Academy? Like, what types of sessions should we be offering to help counteract some of those things? Do we have a partner or a funder that can provide some relief, sponsor some families, make some deposits is what I always tell people. And so that to me is part of why we've been able to be successful and how we build. So it's looking at the formal data, but it's also looking at the informal data and having a team of folks who are working on it that are reflective of the people that you want to serve. And so if you don't have that in staff capacity, find a way to build that in people capacity. You know, that's another piece of it. So I think the outreach for me has looked very different in different segments of the work. In this catalog in particular, it is about taking the evaluation data, even from the previous session, what was popular, what did nobody show up at? You know, was there a reason for that? Or is it just not resonating with people? Should it be done in the church, at a restaurant, in the neighborhood? That's another piece of it for me. It's not about if you build it, they will come. I don't believe that. I believe you got to build it and take it to them, and some people will come. And there's a multiplicity of things around how you get this work done. And so in our next catalog, we have, you know, some of our faith-based sites that'll be offering sessions. We have parents who are offering sessions. We've done pop-ups in places like McDonald's to offer sessions, because that's where people naturally gather. I think the other piece that was, I think there was a readiness in the district. So I indicated new administration in terms of, you know, coming in and people were looking for fresh ideas. And at the same time, just recognizing that there were some things that just weren't working. And so I think there was a readiness during the time that we actually implemented this. I also think that it is about going in, recognizing what worked well. I remember coming to the district, and the first thing that I felt heavy on me was to pay homage to the people who were still here. Not to look at what was wrong and now we're all here to fix things. Absolutely not, because people will tell you what you ask, but they will never tell you what you need to know. And so it is coming in, understanding that this, what we inherited might have been 10 times worse if we did not have people in this system holding it down. And so then asking them, you know, what would you like to see? What do you think the issues are? So teacher engagement in other schools, one of the reasons I put that there is because we all have collective ownership in implementing work in this space. So it's not just the staff that I have. I also had teachers across all the schools think about something they wanted to teach, not just the academia. Maybe you're somebody who loves science and you want to work with parents and students to make snow cones. And so giving them the ability to do that without a pacing chart, right? Or maybe you like to crochet. We had a great, very strong, we're trying to restart it, crochet club over in Southwest Detroit. And so, but it's really looking at the talent across the district and making the Parent Academy something where people can offer their talent and skills. The other piece for me that made this work really well was I raised outside dollars and supported some of the things at the school that they did not have the dollars to support. But it was like, okay, you want this, you want a particular program for your parents. Maybe it's the traveling, there's a traveling zoo, an exotic zoo that happens. and then I could support it. So again, it's making deposits, it's making and creating an opportunity for other people to not just tell you what they think, but actually be actively providing something in it. Let's go to the next question, Jeremy. I think it was, what did it take for me to get buy-in? So I talked about a little bit of that. It's input and reflecting that input. So it's nothing for our parents or our teachers to see themselves in the next issue. Really highlighting and recognizing what they've done, or their contributions in this space. And so the last thing you want to do is ask people what they think and then do none of it. And so we try to intentionally make sure that we send out separate communications saying, hey, you're being highlighted in the catalog this month, your workshop is on page such and such. And so over time, you just kind of build, people come to expect it. Leveraging brand and success, what did it take to build it? Well, people know this has been my body of work for a very long time. And so I think that looking at, are there some others who are currently doing some of the things or being innovative, are working well in community that you really can partner with? What is already successful, and that with your added support and lens could actually help expand that work. I think too often, we want to just do our own thing. And I think we're in a day and age where it really is about, smart collaborations. Now, I'll tell you, I was one who people call me to collaborate all the time. And half the time I said no, because if we're not in alignment, I don't want to waste my time and I don't want to waste yours. And so looking at smart partnerships around what you want to do, that was a big piece for me, that I could show people what was in it for them. I could tell our principals, look, you're not spending your Title I money every year. You need some help in this space. All you have to do is give me the dates and the times, and my team will come in and do the organizing. So providing them with some support. And I'm also going to incentivize it. And, at the end of the day, sometimes, it's just over time, people get to know and trust you. Let's go to the next slide.
Dr. Buckman, we have about a couple minutes left, and I also want to make sure that we have time for questions.
Well, I'll do 30 seconds then. And I can also just leave this, but how did consensus come around? Again, I would just pick one thing off this slide, and that is just demonstrating success. Sometimes people doubt it, but get out there and make something happen, and people will get involved. Let's go to the next slide. Any obstacles every single day. Getting people to think outside the box and be creative, and talent are some of the obstacles that we actually have, but you work through them. Next slide. How do parents change? I think obviously education and awareness, but also just self-efficacy, which has built a pipeline of talent for our district in terms of some of our parents have become full-time staff, part-time staff. Every building has a person that is engaged at this point that represents parents. Next slide. And administrators change, increase partnerships, responsiveness. Next slide. Maybe I'll stop here. How about I stop here? We can leave that slide up for people to read, and we can just open it up for questions. And I'm happy to talk with folks later if Jeremy wants to share my contact information as you're working on your individual projects. Are there any questions?
Thank you. Thank you, Dr. Buckman. I just wanted to make sure we had a little time for any questions
Sure.
from our audience members.
One question I have is, as you as you develop the parent academy, do you see any synergies that this task force could use to maybe make sure that there's a technology academy or something similar available to older adults?
Yeah, I think
that could operationalize the best practices as you shared.
Yeah, I think that some of it is always giving people different options. Like, we want everybody to be digitally savvy today, but we also have a phone number that people can call in office, somebody who can assist you. And so I would just say looking at multiple platforms for people to be able to access the information and participate.
Thank you.
Thank you. Any other questions?
Are there any opportunities for doing some intergenerational things with the Detroit Public Schools as it relates to technology?
Oh, absolutely. I think, you know, it's, so absolutely. That's my short answer. I think we can talk more about, you know, what does your program look like? What do you want to do? I think we're always open to partner. We have lots of grandparents raising grandchildren. A lot of times our young people are teaching their parents how to navigate and use the technology. We do some workshops on that, but we love to partner on something like that. For sure.
Thank you.
Thank you.
Well, this is Deanna Solomon. I would be remiss if I didn't. I want to just express my gratitude. I appreciate you, and
you.
I really value the work that you've done in our public school system. And I do remember when that first book was released, and just how exciting it was as a parent to participate in some of those workshops. I really have to acknowledge as well how creative and just really direct you've been over the years in meeting people where they are. I loved your
Thank you,
door-to-door
Deanna.
campaign, and I really feel that our seniors, I know during the pandemic, they really that was a make or break
Yeah,
for delivering care. And I really feel that we need to continue that with meeting
absolutely.
them where they are. That is how we connect with those that are either homebound or just don't get out as often, right? Uh,
Absolutely. Absolutely, Deanna. Thank you
uh,
for that acknowledgement. And I worry about our seniors. You know, we've set up resource centers, but we have a list where we do regular deliveries to some of our seniors who we know are taking care of second and third generations. Again, we have students who lost both parents. And I think that you know, we've been able to do technology support right at the door at times. And so, you know, I'd be interested in learning more about the program, and again, open to partnership around the multi-generation programming. So thank you so much for having me today. I mean, I
Thank you.
hope I was able to share a little bit that helped, and look forward to continuing the conversation.
Thank you, Dr. Buckman. Anne, did you want to move into the work plan and project tracking, or do we want to save that for our
Well, just wanted to announce
subcommittee
that.
meetings?
Just wanted to now announce that MPHI, as a facilitator of the task force, developed a work plan and a project tracking tool. So at our next subcommittee meetings, we will make sure that the work plan strategies that were discussed at the January meeting are embedded in that tool, so that the co-chairs can sort of guide the work of their respective committees. And then we'll also be tracking the projects that we prioritize during 2023, so that we can sort of have a Gantt chart that's visual, but also track our progress on the subcommittee level and also at the 4 key deliverables level. So we'll be sharing that prior to the meeting, and then getting your reaction and input so we can launch the use of that tool.
Thank you. And I want to uplift a comment made by Jean Johnson. So they said in the chat that they have non-paid interns at Bicentennial Tower. Is there a way for DAAA to create an opportunity for them to receive a stipend for community work research for DAAA while here?
I would like them to reach out to us.
Okay.
We have approached Wayne State University, and we do have during the planning phase, we had students, medical students working with us, and we still have one intern working with us. So we're definitely open to that possibility. Love for it to
Okay.
be intergenerational.
Okay. I'm not sure if they're still in the chat. But we'll try and find their contact information. Well, we have come to the end of our full task force meeting. Thank you, everyone. Special appreciation to Dr. Hop as well as Dr. Buckner for your both fascinating presentations. And thank you, everyone, for making time for this very important meeting. And I'm excited about the work that we have to do, and all these fascinating topics and so many intersections, and really the commitment that we all have for thinking about digital literacy for the senior population. So everyone take care. I hope you have a great and blessed rest of the day.
Thank you for the opportunity.
Yeah, thank you. Thank you all.